United we're as strong as a mountain.
This is Steve Zeltzer with LaborFest and Workweek, and I wanted to welcome you to this program, which is going to be about the crisis in healthcare, single payer and working people and unions, and the great crisis we face in this country around our healthcare system. And it takes place, this panel, in the midst of a major attack on Medicaid, and from 12 to 36 million people may be losing their Medicaid because of this bill passed by the Congress. And also not talked about is that 500,000 to 1.2 million working people, healthcare workers, may lose their jobs, which is going to be catastrophic for people in this country. There's a shortage of healthcare workers, a shortage of nurses, a shortage of healthcare workers, and then we're going to lose a large number because of cutbacks in Medicaid, rural hospitals, and the whole healthcare system. And in California, there may be 217,000 healthcare workers who lose their jobs. So this forum is going to have some speakers to talk about this from different areas of healthcare and what's going on, and also what we can do about it, because unless we defend our healthcare and get a system that works for people, there's going to be a catastrophic situation. It's growing much greater, the crisis in healthcare. So our first speaker is Dr. Anna Malinow. She is the former president of the Physicians for National Healthcare and is now living in California, the Bay Area, and working here around the issue of healthcare. Welcome, Dr. Malinow.
Thank you, Steve. Thank you so much for the invitation. It's a real honor to be here with wonderful panelists. And I think what I would like to mention briefly is that there is no question that our public healthcare structures and facilities and programs are under historic attack. Probably about $1 trillion in cuts to Medicaid, plus 500 billion cuts to Medicare, will result in about 12 million people losing their Medicaid coverage, 5 million more probably losing their coverage through the exchanges. And that's in addition to the 25 million that we already have who are uninsured, and the millions and millions who are underinsured in this country. This translates probably, according to some researchers that recently published in the Annals of Internal Affairs, to about 16,500 medically unnecessary deaths as a result of these cuts. So there's no denying that these are historic cuts, that they're horrible and deadly lethal cuts. But I think it would be a mistake for us at this point to think that we should go back to the status quo. It's our natural tendency when we are when we're being attacked, right, to go on the defensive. But I really believe that this is our chance, and that this is now the time for us to go on the offense. As I said, it would be a mistake for us to think that we need to protect the status quo, because the status quo is not what we need. We need to elevate our demand for a national single-payer healthcare system that is free from profit, covers all medically necessary medical benefits, and it covers everybody in and nobody out. So this is our chance under this historic attack to go on the offensive and to demand the healthcare system that we deserve. You described, thousands of people losing their jobs. We have a healthcare system right now that is a patchwork healthcare system where we have 70 million people who are on Medicaid right now, but that is medical segregation of the poor. that is the kind of healthcare system that we have. We have a healthcare system that are for people who manage to get it from their jobs, and 70 million who have to prove their poverty month after month in order to get healthcare. And that's really not the kind of healthcare system that we necessarily want to fight for. So what we need is to elevate the demand, and we need to fight for a radically new agenda, and that is a national single-payer healthcare system free from profit for everyone. So that's what I have to say right now, and I'm happy to take questions later.
Okay, thank you. Thank you, Anna. So our next speaker is Kate Tillow, and she's with the Unions for Single Payer and has been active in the labor movement around fighting for the unions to take up single payer. Welcome, Kate.
Thanks, Steve. I'm really pleased to be here with you to talk about this, my favorite topic, since it's something that I've been working on for quite some time, ever since I came to understand what was happening with our healthcare system and what it would take to fix it. I think one of the important things for people to know is that the employer-based coverage, which is often referred to as the gold standard, as though this is really great coverage in our healthcare for people who have good jobs and who have healthcare coverage through their employer. I think it would be important for people to know that that system is not working. And in fact, it is so expensive that and continuing to get more expensive. In other words, the escalation and the inflation on healthcare is greater than the inflation within the general economy, so that it worsens with every year. But right now, as of 2024, employer-based health coverage for a family averaged $25,572 a year. Now, if you think about that, it's like $12.50 an hour. That's what it costs through an employer-based system to cover a family. That is much more than the minimum wage in the country, which is $7.25 an hour. In other words, if you work at minimum wage, you can't even, if you would give every penny that you earn, you could not pay for the family coverage that we have in our country. And of that, the average employer pays around $19,000, and the employee or the worker pays about $6,296, which means that the average worker who gets family coverage is paying $500 a month in order to have this coverage. And it's not sustainable. And even once you have this coverage, which is supposed to be the gold standard, and this is the best, you still have deductibles, and there are co-pays, and there's co-insurance, and there's prior authorization that can deny you care. And so we have a system where more and more and more of our people, even though they have coverage, can't get care because they can't afford what it costs, or the plan doesn't pay what they need to cover that. But that situation within our society means that we can't get improvements in our wages, because every year we need to put more money into paying for the health coverage under the system that we have. So it is totally within the interest of all working people to change this system and to have a publicly funded system that would reduce the profits and the administrative waste within the system, making the system less expensive, and that would not put the burden onto workers to pay for this. And there are so many reasons why that would be better. For instance, when your employer controls your health care, it gives that employer tremendous power over the worker. In an organizing drive, workers who want to organize the union, it's very threatening to lose your job, because when you lose your job, you lose your health care. We would have more freedom to organize if we could remove that burden and assure that working people are covered regardless of your employer. The same thing holds true when there is a lockout or a strike. I have that experience being in the union movement. The first thing that happens when there is a strike is that the workers get a letter saying that your insurance will be expiring on such and such a date. A tremendous pressure on people. I mean, think of the ones who have, a sick child undergoing treatment, the kind of pressure that brings to bear to give in to the employer's demands. And so if we could free our healthcare from the corporate control of our employer, it would free workers to act in unity and to be able to win more. It also would put into play the ability to get that money that is going into healthcare restored into wages, so that we wouldn't continue to just have a decline in wages in relationship to the cost of living. So there are many, many other things that it would do. I also think that it would, if the labor movement will lead this struggle to win healthcare for all, that will be seen by the working people within the country. And that will be a big impetus for other workers to join and to organize and to see the labor movement as heroic in leading that battle. So that's what we need to do, is to get the labor movement presenting the forward motion that would take the high road. And instead of just following behind, the Democratic Party, following behind the even worse Republican Party, and saying what it is that we need. And I think we see that there's a very, very recent poll that was done that says it's about 60% of the people in the country are in favor of Medicare for all. That should be a huge impetus for all of us to say that this is a winnable issue. This has majority. It's not that we have to convince people. We just have to put people into motion to make it effective. And of course, the labor movement is a powerful force in doing that. And we have to do some work to try to make that happen in the country. Thanks.
Thank you, Kay. So our next speaker is Ed Grystar. He's the past president of the Butler County, Pennsylvania Central Labor Council, and a longtime activist for single payer and for national health care. Welcome, Ed.
Yeah, thank you, Steve. And I too am welcome, or I'm pleased to be able to participate in this call, in this panel. And starting off with, I think I would go back to, just as the context is, how is it that there could be such a disconnect? And I think there's a disconnect, obviously, politically in the system, where the polls have pretty much consistently, and the latest poll just reiterates that there's a vast, strong current of support for Medicare for all, single payer healthcare in the country. Yet there is not only a political disconnect within the Democratic and Republican Party. In fact, the Republican Party obviously is moving against that current, and the Democratic Party for many years just kind of gave lip service to single payer, even though the crisis was still unfolding, even with Obamacare. And it just has gotten pretty much worse. But inside of labor, the actual institution there, the leadership of labor is kind of backward. Not kind of backward, they're backward. They're not putting up a fight. They're not taking this issue and pushing it forward. And the real question for us is, an activist is, well, if you're in a union and you work on your job and you negotiate your contracts, it's pretty obvious that you're not going to be able to achieve the kind of health care that you deserve. And will the unions, and that's the question before us today, how can we, inside of labor unions and outside of labor unions, because remember, the working class is more than just the organized workers. There's tens of millions of people. In fact, even under Biden, the number of people organized in the union actually fell. And constantly you heard people saying, well, Biden is the most pro-labor president. And I think what it is that the labor unions, simply because of their, and I will say it, their lack of any ideological framework to deal with the crisis, they're simply incapable under the current leadership. That doesn't mean that the mass of people in the unions have to follow that leadership. And I think what I'm saying is we have to come to grips with the people who are running these unions. The leaders of these unions are not really doing what is even remotely possible under the current circumstances to put up a fight. And in fact, there's almost no fight. You have Trump doing all the things that I don't want to go over, and the Congress passing all these items. And you don't see, logically, you would think that the unions, if they were ready to literally just minimally defend their members, they would be calling emergency meetings. They would be calling meetings and say, well, how can we mobilize our forces? What is it that we can do? The current system doesn't work, but you're not seeing that anywhere. It's almost like the deer in the headlights. And I think what it is it's a wake-up call for the conscious people that inside your own labor organization, it would be foolhardy to think that somehow there's going to be a magical thinking intervention from the current leadership that's going to do what is necessary. When I say do what is necessary, I mean just talking to people and calling meetings and saying, let's discuss how we can fight back. Who are our allies? Who are our friends? What can we do? Is it possible to raise the struggle to a higher level? And those are the kind of talks that should be happening inside of labor. And then not only inside of labor, but labor has the tremendous capacity to be the forward spear in this movement. They're the ones that have, even though they're 6 or 7% of the workforce, there's been many articles saying, they're sitting on tens of millions, hundreds of millions of dollars and in their bank accounts. And rather than talk about, well, how can we mobilize people? How can we do things differently that will give us the popular sentiment and capitalize on this? They do nothing. And I'll just give you like one example from, there was a program called Labor Neighbor. Labor Neighbor was like in the 1990s after John Sweeney got elected. And what it suggested, and just think of what I'm going to say now and how this could unfold. Labor has the capacity to get the names and addresses of union members in every community. So if you had a real independent labor movement, you could take those names and those addresses and you could mobilize door knocking and take 4 or 5 issues, single payer, jobs, controlling AI, whatever the 5 or 6 class issues are. And you could go knocking on doors in those neighborhoods and build a real independent structure that would then be the foundation for a forward movement. But rather than do that, and this is the problem, the business union leaders of our labor movement will take their dues money and then they'll take their PAC money and they'll just throw it away into electoral campaigns instead of talking about, well, how, if people are so disassociated with their unions, what is it that we can do to bring them closer into a real conscious identity as to what it means to be a union member? How can we put up an honest fight? And that is really up to people like us. And we talked here before, the younger people in the labor movement, they have to kind of figure it out, and we have to help them figure it out, that the road ahead, this is an opportunity. Are we in a crisis period? Absolutely. But I think if you go back to the 1919 steel strike, and I'll end this because if you read about the 1919 steel strike, the leaders of the 1919 steel strike, this is in Western PA, that's where I'm from. And for those of you who went, my labor council was Butler County Labor Council. Butler County Labor Council is where Trump almost got shot. I was the president of that labor council, and we can get into some of the programs that we did there 25, 30 years ago, which were like light and day from what's happening today. And so what happened? Did they change the drinking water in Butler County 25 years ago? No, there's just an absolutely disconnected leadership. So I get back to the 1919 steel strike, and I'll end it on this, is that one of the things that they told the workers, the leaders of the unions, they said, we have to assume that the people understand they're getting a raw deal. We should not assume that we have to go dancing around them and explaining things. They know they're getting a raw deal. They know how to articulate it, but our job is to provide them a way out. And that's really what's missing today. What is the way out inside of labor? How can labor be rejuvenated? It's going to take new elections. It's going to take new leaders. It's going to take rank and file committees inside the unions to start talking about these things. Otherwise, there's not going to be the capacity to do the necessary fight to even hold on to what you have, let alone talk about national single payer. So we have to kind of face the facts that we have an opportunity. We should be confident that our message resonates with people. We just need more people to work on pushing it. And I think that's our goal today. It might take a while, but there's really no other way out. So I'll be glad to put some more kind of like meat on these comments. And I want to thank you again for the opportunity.
Thank you, Ed, for that contribution. And I'm going to be heading out to Pittsburgh, your neck of the woods, in August. And one of the reasons I'm doing that is because of my union, which is the CWA, having a convention. We have a resolution for single payer, which I got passed by my local. Hopefully the CWA nationally will take it up, but also to support the brothers and sisters in East Palestine. Because if there's any example of the kind of crisis in our healthcare system and basically criminality of it, is the fact that they have been contaminated in a derailment by Norfolk Southern, gotten sick and lost their health care, and now are fighting for their lives. And joining us is Chris Albbright, who's was a member of LIUNA Local 1058 and a resident of East Palestine, who's been living a nightmare with him and his family, really trying to struggle to survive and without what he needs to have for him and his family, the health care that they should have. So welcome, Chris.
My turn. Okay. I'll give you guys a little bit of a background of what happened here in East Palestine, what happened with me, my family. Most of you guys know we had a train derailment here back in 2023. Wasn't long after the train derailment, I experienced a lot of different issues. It started with headaches. It started with random vomiting. It started with a couple different things that happened, and I ended up finding out that I had congestive heart failure, which turned into severe heart failure. Through this process, well, let me interject one other thing too. And during this time, my one daughter was getting nosebleeds every time she stepped in the house. My wife now has high blood pressure. My youngest daughter, I don't like divulging this very much, but at 8 years old, she started menstruating. And these are all factors due to the train derailment and contaminants we've had, in our lives now. But I've had severe heart failure. Due to the fact that I had severe heart failure, I lost my job. And in turn, when you lose your job, you lose your health insurance. The drugs that I have to take every single day, I have a plethora of drugs sitting over there. They're not cheap, and they are what is keeping me alive right now. So as far as like the way our health system works right now, it's criminal. It's wrong. I mean, how are people supposed to afford these things? How are we? And like I said, this was due to something that wasn't my fault. If I could go back to February 2nd of that year and leave and continue to work and continue to provide for my family and continue to have health insurance and everything else, in a heartbeat, I would have done it. Instead, I got thrown into this. I've been dealing with this now for the past 2.5 years. Everything about this whole system is wrong. It is. I mean, how am I supposed to keep living, literally keep living in a system that really makes it way more than difficult for us to do so? I can't afford those drugs. There's no way I can afford those drugs. Luckily for us, in a way, luckily, we ended up getting on my wife's health insurance, which was way worse than what mine is, but at least we have something. It's a higher copay. It's a higher deductible. Everything is higher on it. And that's the reality of what I'm living with right now is, I mean, like every day, you know, there were times we had a debate on, not really debate because it wasn't a debate, on buying my drugs or paying the gas bill, buying my drugs or having food in our fridge. It's a shame. It's not what this country is supposed to be about. This is not how it's supposed to happen. This is not how we're supposed to look out for each other. And I am a prime example of that. And I would be happy to answer any questions that anybody has about anything on that and what happened here and what's been going on since there and what's happened to me. And, you know, since this whole thing happened, it's been devastating. All of my savings, I had 3 different savings accounts. They're all gone. They were gone a long time ago, just trying to survive. So how we're doing it in this country right now, it needs fixed. You know, you go to other places, you go to other countries, and it's not like this. Steve has talked before plenty of times. You know, I don't know if he's told you guys about the one lady who was over in Italy, I believe, Steve.
Yes, she's here.
Oh, she's here. There you go. There you go. See, there we go. Who went over there and got taken care of. No problem. No payment. There you go. I'm a resident of this country and I can't get taken care of at all. It's a shame.
We'll go to that person, Carol Lang, who was in Italy and also has been fighting in New York City around the issue of healthcare because they want to take away their Medicare. And this is something we haven't really addressed yet, the privatization of Medicare through Medicare United or United Healthcare and what's going on with that. So welcome, Carol. You're with the United Front Committee for Labor Party and Professional Staff Congress at CUNY College.
There's almost too much really to talk about. I was in Italy in June and I fell on a very wet floor and smashed my leg and ended up going to the hospital. And I kept saying, so how much is this going to cost me? And they looked at me like I was insane because healthcare is a right. Because the working class in Italy historically has been more powerful and more active than the working class in the United States. And so they still have those remnants of, you know, things that they won after World War II in terms of healthcare and all of that stuff. So, and the working class is much more militant in general in Italy. So I got my leg fixed and I came back to the United States and they refused to accept what the Italian doctor said, that I was okay. So they put me back in a hospital before I can go to into rehab. And I just got a bill, and the piece of the bill that of my being in the hospital for a couple of days was over $12,000. The whole bill is $30,000. But they know that Medicare is going to pay for it, so I had to pay a copay. So, I mean, I agree with everything that Kay said and Ed said. The problem is the union leadership. They are not willing to fight because they don't want to fight. When I came back, I'm a delegate in the union, and I said that, we need, what's happening here is that Medicare is paid for, 80% is paid by the government, as I'm sure everybody knows, 20% is paid by the city. And so the city doesn't want to pay for it, so it's been trying to claw back that 20%. And my union has really made no concerted effort to protect that. There's been a group of retirees that took the city to court. And then finally, Mayor Adams, who's a real pig, decided that he wasn't going to impose that on us. But it had nothing to do with the union. The union did nothing. So at the delegate assembly meeting, my president kept saying, well, that 20% is GHI, at group health, and he named all, and I'm going like, why aren't we talking about single payer? Millions of people are either not covered or will be kicked off of the rolls, and you're talking about GHI and Blue Cross and Blue Shield. And when I told them that I broke my leg and it was completely free, I paid for nothing, there was no response on the part of anybody in the delegate assembly or my president or anything. So the unions don't want to fight because of the fact that a lot of them get kickbacks from the city. So if in fact they don't have to pay that 20%, then in fact that 20% could go to people who are on the payroll. There are Teamster leaders that are on the board of Emblem and who are on the MLC. They're not going to fight for single payer. It's one of the other things that the unions want is to prove how wonderful they are by getting great health care. So they don't really care about people who don't have health care. And they have, like DC 37, which is part of AFSCME, has 130,000 people in the under 20,000, and they don't care about anybody else. If they don't have health care, well, that's their problem. So it's a selling point for the union also to say that, look how wonderful we are, we got health care. And so everything that everybody is saying about the unions are all absolutely true, and that we got to get rid of them. They are not only completely connected to the Democratic Party, that's their approach, but they also have their own particular, thing that they win when they, fight for healthcare only for their particular members. And the retirees are now being faced with losing that 20%. If in fact a mayor comes along and Mandami, who said he's opposed to Medicare Advantage, has not said that he is for single payer. So none of these people, even the Social Democrats, are for, health care for all. And I think that when people are finally being faced with losing their health care, as Chris is, that people will be profoundly upset, and that the streets will swell with people who are going to fight for health care. I mean, not only for themselves, and we're talking about people who are 60, 70, 80 years old who may be losing their Medicare and being forced into Medicare Advantage, which basically means higher, more pre-authorizations and the whole thing. And so, many, many seniors will end up dying because they won't be able to afford to pay for the health care. And I just recently read an article that somebody sent out about United Healthcare and Aetna and CVS and all of those that are basically padding their own stocks by buying back their own stock and raising, looks like, that they're a wealthier company than they actually are. And we're talking about in the billions. So rather than putting money into healthcare, they're buying back their own stocks at this point, which many corporations end up doing. In any case, I was so shocked that I kept saying to the doctors, "What's the bill?" And they looked at me like I was nuts, because healthcare is a right in Italy and in many countries in Europe. So we have to spread that word to people, and which I am doing, that healthcare is a right and should be a right, and that if the union leadership is unwilling to fight for that right, then we have to get rid of these people and fight for a union leadership we could shut the country down. We're millions of people we can shut, which is, I'm always raising general strike. But, the more that other people participate in this, the more likely that other people will continue to listen. But it's those liberals out there and those, union leaders that and even the physicians for nationalized health care are basically not fighting. They're fighting for single payer, but they're not fighting for a general strike. They want the Democratic Party to give them this largesse. And we have to tell them the Democratic Party is part of the ruling class, and we're not going to get it without striking. And I think that should be in the forefront of everything that we say to people about this.
Thank you, Carol. So before we open it up, I wanted to make a couple of comments. I got a resolution passed by my local to go to the convention and to the News Guild, and also to the CWA convention. But, from what I can understand about my union national convention, it's not an emergency situation for them. In fact, I asked about fascism. Trump has attacked journalists. There's a threat of fascism in this country. No response. But one of the things that is most dangerous is that if millions of people are going to lose their health care as a result of these budget cuts, there is no campaign, and this is what Ed was referring to leaflet, to talk to healthcare workers, to talk to nursery home people who are in the nursery homes and workers, and say, we've got to do something. The idea of a mass action of millions of people for national health care, that would help push for national health care. And I think that they're taking the Band-Aids off now, which was Obamacare, which was we're going to patch it up and let people go into these insurance exchanges. Well, they're going to get rid of it, and they're going to increase the cost of insurance if you go into those, and millions of people will lose their insurance. When I read the figures, 500,000 to 1.2 million workers, many of those are union members who are going to lose their jobs. Yet the unions, the SEIU, AFSCME, none of these unions, my union, CWA, are actually telling their members, get ready for these cutbacks. They're coming. It's as if you put your head in the sand, it'll go away. It's not going to go away. And in fact, the only way we're going to change it is to waken people, to mobilize, and to use the power of labor against these things. That's why we're having this action on the 30th. We're going to have a rally in San Francisco, a press conference at Alcatraz, because while they're cutting healthcare, they want more money for prisons. They want to spend probably over $1 billion to rebuild rebuild Alcatraz as a prison, working prison, which is insane, considering people are losing their healthcare and dying because they can't get healthcare, and we're going to rebuild a prison for a massive amount of money. So I would open it up and comments. There's also going to be a conference that we're having, a national conference in Portsmouth, Ohio, around the contamination of people at that Pikeston, at that nuclear processing plant, who've been contaminated, their fight for healthcare, and their fight to have healthcare. And there are many contaminated sites in the United States, radiation, toxins, and all these people are not getting the healthcare they deserve. We're fighting for the Stafford Act in East Palestine, which would allow for money for people to move out of their homes and have health care the rest of their lives, which is what they need. So I would open it up and comments, questions. Cosby.
So, trying to understand clearly, Carol, how much did you pay or not pay totally after staying several days in the hospital?
As a Medicare recipient, basically Medicare was paid for. I ended up paying $300, but I could have paid, if I didn't have Medicare, many, many thousands, because the bill was $30,000. 12,000 of which was just 5 days in the hospital. I mean, it was just phenomenal. But I got the operation and spent 5 days in the hospital in Italy and didn't pay a cent. I paid and even a PT person came to my bed and started, doing PT with me. So it was here that I paid, and I didn't pay anything there, and there is where I got the operation.
Anna?
I wanted to also bring up the fact that the cuts to Medicaid that are going to happen and the resultant number of people that will be kicked off Medicaid, which we're thinking is going to be about 12 million people, probably is not going to start until after the midterms. Not only that, during the Biden administration, when he called the end of the public health emergency, they started to do something called Medicaid unwinding. And as a result of the Medicaid unwinding, over 18 million people lost their Medicaid during Biden's term in office after he ended the public health emergency. So I think that this is something that we need to bring up, that this is a bipartisan war on the poor and on our healthcare system. It's not, I mean, Trump is doubling down, yes, and it's historic. However, this was happening under Biden, and nobody was out on the streets demonstrating and asking that people be allowed to go back to get their Medicaid benefits. And that's why I think what we need to do is to have a radically different agenda. We cannot go back to the status quo of winding and unwinding and people on Medicaid and not on Medicaid, and people having to pay, the 20% premium either out of pocket or having to pay for United Healthcare or another private insurance company to pay for that 20% on Medicare. Plus, what Kay was talking about with employer-sponsored health insurance, which is considered our gold standard, that I think something like 20% of people with employer-sponsored health insurance, according to the Commonwealth Fund, are underinsured. These are people with employer-sponsored health insurance that are underinsured because they pay so much for their premiums every month, plus so much for their deductibles and copays. So is this the kind of healthcare system that we want to fight for? I think that we really, really need to reset ourselves and to recognize that our healthcare system is so broken and has failed us and failed so many people that we need to fight. And I think that what you are all talking about with the unions leading that fight would be great, is what we need. And we certainly need that fight.
Okay, Chris, and then Ed.
One of the things I want to touch on is what she said earlier. She spent $12,000 for 5 nights in the hospital. That was one night for me. And when I went in the hospital, I've been in the hospital a couple different times now since the train derailment. One night in the hospital was over $12,000 to stay there in critical care. one night. How are you going to pay that? How do they expect people to pay? And at the time, we didn't have insurance, so I'm sending them money, whatever I can, whenever I can, however I can. But like, how is our government, our system, our country expecting us to do that? Like, one night in the hospital, $12,000. That's insane. Something needs to be done.
Absolutely. Ed, and then Carol.
Yes, I again back to like, what is it that the conscious people inside the unions, how can they kind of change the tenor of the debate? And I think part of it is to kind of like be honest with people, starting with the idea that you can explain many of these things simply by the fact that it's privatization. I mean, the previous woman said Medicare is 80%. Well, Medicare was 80% back in 1965. And why was it? Because there was a political and ideological fight in Congress that they were not capable of pushing Medicare to be 100% coverage. So who were the people that were pushing for the 20% in co-insurance? So you had to buy insurance. Well, it's the same people that have been working to destroy Medicare all along. You know, that you had HMOs, you had, managed care, you had all those things are privatized insurers. And so rather than the labor movement taking the high road and simply explaining that to their members and saying, these are the people that are your enemy, they're not your friends. They provide, privatization provides no value to healthcare. Nothing. It's just a middle person taking your money. But you don't see that in the labor movement. And the reason you don't see that is because we don't have the kind of leaders that are capable of doing that, wanting to do it. But that's really the only way out. And not only is it the only way out, but it is the popular sentiment. You could capitalize on the 60% of the people that want it simply by explaining it. So I think that in 2020, what Anna was talking about, Bidenism, in 2023 in Pittsburgh, our group, the coalition of PNHP and our single payer group in Pittsburgh, we had a county council of Allegheny County had a summit on medical debt. And we sent out letters to every single Democrat saying, did you know that Biden just cut millions of people from Medicaid? And not one of the Democrats gave a shit about it. None of them responded at all. So how do you think that they're going to be capable of fighting this now? They're not. They can't be. And the proof of the pudding is that they aren't capable of doing anything but holding these amorphous rallies that just suck the energy out of the movement, confuse people, but provide no direction. That's where we come in. And I think that's the face. And a lot of people say, oh, that's too hard, Ed. You can't do anything about that. Well, you know what? That's really what we face. And the positive thing is that, again, we have the sentiment of the people. They're confused. They're looking for a direction. And we have all of the arguments and all of the points to explain it in an honest way. And that's really our role inside of labor and outside of labor.
Okay, Carol?
Well, first of all, healthcare is run by a capitalist. And so everything is about profit, and it's about making as much money as they possibly can. And that means that, Chris, they're more than happy to let you die or anybody else die, because basically it's a dog eat dog world, and they need to make their profits and everybody can go fuck themselves. But, the union leadership is really responsible for all this, for not only pretending that the Democrats are our friends, but the person who was president of my union, her name is Barbara Bowen, before the guy who was president now, basically said, and I belong to an opposition caucus inside my union, so we're trying to get all this dirt on them. Basically, she said that we don't have to be concerned about any of the social issues, about fighting for health care, about doing any of those kinds of things, better housing, because our job is to just get better wages for our workers. And that's it. And she's not only was in the DSA, but my union is being held up as a social justice union. So, and in fact, we had a discussion about Palestine, and one of the people who was a delegate got up and said, well, we're a social justice union, we teach. And that makes us a social justice union, which basically means you can't question these people because they're just full of themselves. Their argument is that they're a social justice union, and therefore, that's the end of the story, period, full stop. And they are the ones that continue to allow the capitalists to continue to make money off of our pain and off of our suffering and off of our sickness. You should read the articles that are coming out about United Healthcare and Aetna and all of these other companies that are now not only buying back their own stocks, but they're going to be raising, the drug companies are going to be raising the cost of drugs by, fourfold, fivefold. People are going to die. Many people are going to die. And that's not just seniors, but that's all the people that are being kicked off of the rolls. Or, in fact, the people who are in the most debt in the United States are people who have health insurance. Because by and large, the people who had Medicaid were able to get their stuff for free. And people who are rich are able to, they don't need to pay either. So it's the working poor that end up having to be, paying the most. And as Chris was talking about being in debt, millions of people are in debt. So the problem is that the union bureaucrats, who kowtow to the Democratic Party. And I hate to say this, the Physicians for National Health Care basically have done nothing, at least in New York. And they are, calling on the Democratic Party to do the right thing. So at the last demonstration that we had, this woman got up and said, Roosevelt gave us everything that we've got. And when I got up and said it wasn't Roosevelt, it was that workers took over the factories and they were afraid of revolution, she got somebody to tell me basically to stop talking. Essentially, he hit my elbow and my time was up. So the physicians, I hope that they're different in other states, but they have been traditionally completely reformist. They've had, support the Democratic Party, and that's it. They don't call for shutting down the economy, shutting down the society. We need to have a new leadership that's going to be willing to be militant and aggressive and call for a general strike. That's what we need. We need to call for a general strike and end things the way that they have been operating all along. And if that doesn't happen, many, many, many people are going to die.
Okay.
Yeah, I think it's important that we help people to understand that the Affordable Care Act, which is much praised everywhere, was not the form of reform that could solve the problem. I mean, that's really important to understand. It did cover more people under Medicaid, but let us not say that Medicaid is so great. Medicaid is a system that the disabled and those of low income are put on. Many people on Medicaid cannot get into a specialist. Medicaid pays at a lower rate. What better way do we have of telling people that we don't value their lives than to say we're not going to pay for your health care at the rate that private insurance pays. There's prior authorization. Medicaid in almost all of the states, with the exception, I think, of Connecticut and maybe a couple of others, is privatized. It means that the money is going into the coffers of a private insurance company that then is in charge of making the decision about how it will be spent and in what way. Medicaid doesn't provide sufficient funds to sustain the infrastructure of the healthcare system. So, we have rural hospitals that are going under, and that's the new crisis. That came out in the news with the reconciliation bill that I think it was the center in North Carolina said 338 rural hospitals are going to close because the cuts in the healthcare in this reconciliation bill are going to shut them down. Well, that's really a crisis. And we can't solve that crisis in any other way than if we go to a national single payer plan, not for profit, and improve Medicare for all that would provide for the funding of those hospitals, because they can't be funded in any other way. The private insurance industry is not sufficient to fund them, and the Medicaid isn't sufficient to fund them. So if we're going to solve it, and we have to solve it, because people, no matter where they live in the country, have a right to health care. And if there's no hospital and no emergency room and no maternity service and no nothing in your area, and it's getting worse, these hospitals have been closing down for a long time before we hit this new crisis. And now it's particularly bad. And what I propose is that we mobilize people in these rural areas to fight to save their hospital and to use the advocacy for a national single payer and improve Medicare for all as the way that we're going to do it to get those hospitals funded. The other thing I'd like to say is that I think we need to begin framing that we're really all in the same boat on this, because no piece of this healthcare system is working. The piece with the workers and employer-based healthcare gets worse every year, with more payment, too expensive, unable to handle it, and eating away at our ability to get wage increases. The Medicaid isn't working. Yes, I have friends, I know a doctor who says, okay, of course, Medicaid did wonders when we got 400,000 in Kentucky onto Medicaid. We saved a lot of lives, and that really is true. But it's still not working. It's not good enough. It doesn't get people into specialists. It has a prior authorization. It's inadequate. It will pull teeth, but won't replace them. It's not doing the things that we need for people to have health care. And Medicare is privatized. And so we now have people on Medicare, which is our best system, publicly funded, but that's being privatized as well. And people can't afford it, and the copays are very high, and it's getting worse with every year. And now there's a new project to put prior authorization into traditional Medicare, which means that's also getting worse. So and we still have 28 million without any coverage, and that number expected to grow by 16 million. So it's like there's no piece of it that's working. And we ought to say, instead of saying some people have it good, we're all in this pickle. And we need to find a way to unite people by saying all of us will gain by removing the profit and getting a single payer system. Every one of us will have more security, more coverage, better coverage will gain with a new system that we fight for.
Chris, but I was going to say a couple of things. Why haven't our unions done this? Why have the unions not fought for single payer, which is the most logical way of getting healthcare to everyone. And the reason is that they support private control of the healthcare industry. They support that. They support capitalism. We have a privatized healthcare system where the corporations make money from the healthcare. If we're going to have single payer, we have to get the insurance companies out of the healthcare business. The insurance companies contribute to the Democratic Party. And as Carol said, some union officials actually are on these boards of directors of insurance companies like Emblem, even for workers' comp. That's another area where there are private insurance companies that union officials are on when workers get injured. And there's a pressure to not provide full health care coverage to workers. So this is in my union, in the CWA, we cover healthcare workers in New York and other places, Tennessee. And, our union needs to be calling for national single payer. Let's see what happens to this resolution. But what we need to do is go to our unions and raise it and say, this is a life and death question. We can't live with what we have. And we've got to fight for it and break these chains that hold us back from what they have in Canada, what they have in Italy. I mean, I'm going to try to meet with some Canadian delegates because our union does represent Canadian workers and interview them about they don't have to fight for healthcare there in the sense that we do. They're all covered by national healthcare. I mean, our unions could be explaining that to our members here. Why is it in Canada, right across the border, they have national healthcare? They don't have to worry about going bankrupt from healthcare, and it's right across the border. That is something our union should be educating the members about and saying we need the same thing here, and we have to fight the Democrats and Republicans. If people remember, Jeffries did this 8-hour speech in Congress, big, long speech. Well, you know something? He didn't mention once the need for national health care. Not once about the fact that millions of people are going to be thrown off of healthcare and everyone should have healthcare covered. He didn't say that because he supports privatized healthcare. It means fighting the insurance companies. So I think that that's a political issue that we have to confront in our unions and letting the members know and getting a movement going within the unions to say, we're going to have single payer national healthcare. We're going to take action to get it. And if millions of people are thrown off of healthcare, which they are going to be, we need strikes around that. We need a national general strike. We need to mobilize the entire working class. It is a life and death question. And that's the only thing they understand when you have mass mobilization. That's what got Social Security in the 30s. It was mass mobilization of workers. Chris? And then Ed.
So I'm going to be real with you guys for a quick minute. Steve, I don't think I've ever told you this, and I talk to you quite often. You guys know my situation a little bit. I talk about everything. But because of the situation in this country, like I have kids. I have my one daughter, man. She's my world. She's great. I've pretty much accepted the fact that I'm probably going to die a lot younger than what I should. It's not because I want to. It's because I'm not going to be able to afford it. I'm not going to be able to afford to stay alive for my daughter, for myself, for my wife, for my other kids, everything. And that's where we're at in this country right now. And that's a shame. And that's all I really wanted to say today.
It's a crime. It's not just a shame. It's a crime. We have so much wealth in this country, or people are dying because they can't get health care. That's a crime. And I think we have to wake people up to this country. It's got to stop. We have the right and we have the resources to have health care for all, for you and everyone else. But that's why you're going to Pittsburgh. That's why we're having this national conference, to get your voices and the voice of other people from East Palestine out so people understand that. I mean, one of the things in our struggle to have a conference in East Palestine, we went to the unions in Ohio. This is before the election, to try to get them to support this conference that we had in East Palestine. They wouldn't answer phones. And this happened in Ohio. I mean, working class residents, union members, lost their health care in East Palestine because of the contamination. None of the unions raised that and said, look, we have to support our members, our brothers and sisters, from getting health care. If the Democrats want to know why they can't win an election, that's a good example of it. Because if they had actually focused on East Palestine, if even Biden had instituted the Stafford Act, he could have at least pointed to that and said, I got health care for the people and I got money for them to move out of their homes. I mean, here's one concrete thing for one community, and they wouldn't do it. And not only that, Liz Schuler, the head of the AFL-CIO, wouldn't even meet with Chris and others who went to the office of the AFL-CIO to have an appointment to talk with her about it. You imagine that. Here's some workers coming to Washington, D.C. to raise the issue of what's going on in East Palestine. It's a working class issue. And she wouldn't even meet with the residents of East Palestine. Who are these people? Who are these people? That's what you have to ask. Who are these people that are getting paid our money from our dues, and they can't even meet with workers from East Palestine to talk about the fact they don't have health care, and they're forced to live in contaminated homes after an accident by Norfolk Southern caused by their negligence, criminal negligence? That's what we're dealing with. Ed.
Yeah, just a couple of like anecdotal on the theme that you're talking about there. Some of you remember Michael Moore. Well, Michael Moore, the filmmaker, he actually was in Pittsburgh during the National AFL-CIO convention. I'm trying to think what year that was. It was like maybe 2010 or 2012. And he showed his movie in one of the theaters in Pittsburgh. And it was, of course, a huge crowd was there. And then afterwards, they said, what we're going to do is we're going to march down to Blue Cross and Blue Shield. We're going to have a demonstration. And I have to tell you, you might laugh at this, but literally the Pennsylvania AFL-CIO president, Billy George, told all of the unions that we cannot go to the Blue Cross and Blue Shield headquarters because we're partners with them. And that just kind of typified the mentality. And then a couple of years later, you had Leo Gerard, the president of the United Steelworkers Union, who claims he was for single payer. He claims he's for single payer, yet he now sits on the board of Allegheny Health Network. And he, these are the kinds of people that we need to remove. We need to remove them out. And I think this whole idea of how do you do that, like caucuses within unions and public displays and attempts to move people inside the unions, not with just, inflammatory rhetoric, but facts like we're talking about here. And because the workers, like I said, they're looking for ways out. So we have to kind of like find a way that we can move some of the people inside these unions and get new leaders, a new direction with articulating the positive popular demands that I think will strike a nerve with the rank and file. Because we need labor. We can't win single payer unless we move labor. And so you have to kind of figure out, you can criticize them, obviously, the top leaders, but at the same time, you're trying to win over the mass of rank and file people. So you have to be smart enough. And that's where I think we come in. We should be able to start having these discussions and debates because it is a critical issue. And as we all say here, it's not going to go away.
Carol?
Yeah, a couple of things. One of the things I forgot to mention is that I'm an adjunct at City University, and the rule is that you have to have 2 classes in order to get health insurance. So if you lose a class, you not only lose the money, but you also lose the health insurance. And so this is completely connected to what's happening with higher education and education in general. I mean, not only is Trump going after my union and going after higher education, but, he's going to cut the budget and people won't be able to afford to go to school. So if they can't afford to go to school, it means that people won't be able to get 2 courses, which means that there will be even more of a healthcare crisis in New York City. And I think that somehow or other, maybe this group or some group should come up with a statement about what we think the problem is and what we want to see, and call ourselves something, whatever, unionists for single payer or whatever, And so that we can bring it into the different unions. Steve can bring it into his, and I can bring it into mine. So it won't look like it's just me alone, which very often is me alone. And let me just read you. The ex-president, which is what I was saying, said, let's see, where is it? Well, I'm not finding it now, but basically she said, you know, it's not realistic to be talking about social issues because, I mean, it's very condescending thinking that workers don't care about social issues, that all we care about are raises. And because she doesn't want to alienate people, even though she herself was interested, but nobody else is interested but her. So that, you know, so there's a culture of not talking about society. And there's no more important, you know, question, in my opinion, than healthcare, because it impacts, you know, millions and millions of people. So that we have to defy them, and we have to come up with our own, whatever it is, our own slogans, our own flyers, and bring it into our unions and say, fuck those people. You know, they don't give a rat's ass. They're connected to the Democratic Party. We need to do something else. We need to form a new leadership and, you know, basically, you know, organize a revolt.
Okay, Anna?
Well, I'm not responding to what Carol is saying, although I think that sounds like a great idea. But really what I'm responding to is Chris's comment that is just heartbreaking. It is just heartbreaking to hear someone say that. It's really that it's our healthcare system is so unconscionable that we could have an individual like Chris come to that kind of a conclusion. And especially since we have so much money in the healthcare system, we have the ability to cover Chris's care 10 times over every single year, and every single person in this country who needs healthcare. We have enough money in the system. In fact, if we were to transition to an improved, expanded, not-for-profit Medicare for all, like free from profit, we would be able to save $1.5 trillion. So that it just shows you that the money is in the system. It's just that we have decided as a society that it is normal for us to give this money instead of to treat Chris's congestive heart failure. We're going to take that money and give it to the shareholders of United Healthcare, or to the CEO of United Healthcare, or to the CEO of Humana, or CVS, or Optum, or SureScripts. That's the decision that we as a country have come to, that it is normal for us to take the money that should go to pay for healthcare to go to the profits and to line the pockets of these billionaires. And I think that we've reached sort of a breaking point where we need people to believe and to understand that this is not normal. But we have been functioning in this sort of fog for so many years that we think that what we have is normal, and it is not. What's normal is what they have in Italy. That's what's normal. What's normal is what they have in Canada and in every other industrialized country in the world. That's normal, not what we have. And we have to come to that realization. And that's where I'm talking about. We have to have this radical agenda. It's like we've got to explode our imaginations in our minds that what we have is not normal. What Chris is saying is not normal. It is not normal for us to accept that, particularly since we have all the money, all the means, all the resources to be able to take care of him and millions, every single person here in this country, with the best healthcare system in the world.
Well, I think that says it, a lot of it, Anna. So I wanted to thank you and thank all of our panelists and the people who are here today. We're going to continue this fight, this single payer national campaign, starting this month on the 30th, where there are going to be actions in San Francisco and around the country. And also, we're going to be having a meeting in Pittsburgh on August the 11th. Chris is going to be there, Ed and other people. We're going to be working to get CWA delegates. It would be great if the CWA and the News Guild, of which I'm a member, actually said they're going to fight for single payer nationally against the cutbacks in Medicaid and the other attacks on working people like Chris. I mean, I think that has to be the answer from the labor movement. We're not going to put up with cutbacks on healthcare. We need a national system that uses the wealth of this country to provide healthcare for all. And that's the single payer system. So I want to thank all of you for joining us. And I think this has been an important discussion and a concrete discussion about the reality we face and what we have to do. So thanks for joining us. Solidarity.